All right. So what would it look like if IVF were tax funded? Can you help us theorize a little bit about what a system would look like, the healthcare system would look like if everybody's IVF was suddenly paid for?
Well, it's interesting, Lila. There is a lot of variation from state to state currently. And so there are states that do provide insurance mandated coverage. And so that is about 20 states that have some iteration of this, ranging from full IVF and fertility preservation coverage. By the way, fertility preservation refers to those people who are, for whatever reason, undergoing a treatment that may be what we call gonadotoxic, which is just a fancy way of saying that in undergoing that treatment, they will lose potentially all of their eggs, all of their sperm. So the classic example of this is someone who has cancer, who may be undergoing chemotherapy or radiation, which has known risks of damage to our eggs and our sperm, okay? And so anyway, 20 states have some form of coverage for these already. And so there is significant variance there. There's also variance between which insurance plans offer coverage and the extent of coverage as well. And so going back to your question of what that would look like if there was a mandate, I mean, I think that we have to look at the numbers. What do I mean by that? There are studies looking at the per person cost, IVF cost for a successful live birth. And guess how much that is? In fact, it's about $62,000 for a successful, to have a baby, okay? That can go up to $72,000 on average when we think about using an egg donor. So a woman who donates her eggs to help achieve that pregnancy. And if you look at it just based on the per person cost for IVF, the median per person IVF cost is anywhere from $24,000 if you're using your own eggs to about $32,000 for an egg donor. So it is a significant amount of money that we're potentially having to figure out coverage for.
What would be the cost if the focus, the taxpayer funding was behind a more restorative approach that didn't involve all the ethical issues of IVF? What are we looking at per person?
So Dr. Phil Boyle of Ireland, who is a restorative reproductive medicine physician trained in neofertility, he actually published a paper regarding this and showed that compared to IVF in that healthcare system, the cost savings was significantly less, and in fact was much less than $3,000 to $5,000 per person. Huge difference in numbers when, again, we consider, at least in the US, that cost on a per IVF cycle basis is anywhere from $15,000 to $30,000, and it takes on average at least 2 IVF cycles to achieve a baby.
So wait, if I'm understanding this correctly, we're talking for a restorative approach, which doesn't involve creating babies in test tubes. It involves more a natural working with one's body to understand the underlying conditions you may have with infertility, et cetera, right? You're saying it's $3,000 to $5,000 average for that approach to be used, as opposed to IVF, which is 2 cycles of 30K, potentially 60K plus.
Yes.
It's incredible. So what are the key differences between the restorative approach for treating infertility and the IVF approach?
Yes, absolutely. So I would say that what is each comprised of is the first question. And so restorative seeks to, again, look at what can be optimized. We know there are a lot of organs involved when we think about fertility, okay? And if we even kind of specify to the reproductive organs, that's still the ovary, the eggs being released, the number of eggs, the tubes, the uterus, the endometrium, the sperm. And then we have to take that out on a broader scale and think about that woman's other underlying health conditions, inflammation, endometriosis. Okay, so there are a lot of areas where we can make a difference and take a look at to make sure that each of those parts are optimized, okay? And so that's what restorative reproductive medicine does. It relies upon the signs that a woman has when she's releasing hormones and ways that we can interpret those signs. That's called fertility awareness-based markers, or FABMs. It also relies upon, again, seeking out diagnoses that very commonly in a conventional REI practice are lumped under the term unexplained infertility. And so I think the classic example here is something called endometriosis. This is a condition that is very common. It affects about 10% of women. So worldwide, that's 190 million women who are dealing with this. And unfortunately, 30 to 50% of women with endometriosis will have infertility, and vice versa. 30 to 50% of women with infertility may have endometriosis. So that one, the current REI thinking with that is typically, well, we know let's just move forward and be more aggressive and do IVF. And it's a numbers game trying to get number of embryos, and that will yield a higher chance of pregnancy.